Brian, can you hear me?
Yes, Jeremy.
Okay.
Hi, Jeremy. Yes, I can hear you.
All right, thanks.
Sorry about all that. I don't know what was going on there.
No, we're all good now. No, I got in the link and all good. Thanks.
Okay, so it's recording, so at least that part's taken care of. But I'm just trying to think. I mean, I can send links out later. I'm not sure when I'll be able to send a recording back to the media. Depending on, I'm trying to figure out how I'm because it's going to go to the cloud. I'm going to get a link from the cloud.
Mm-hmm.
But of course, with email issues, I'm not sure when I'll get that. So.
And I can try to work on it from here afterwards. We're having some internet issues at the NHA offices right now, so we're in a separate location. Press conference. Thanks for joining us, Kevin and Megan, and see Brett's on. Wait a few minutes. Great. Megan, you want to check your mic real quick?
Yep. Can you hear me?
Yep. Kevin, you're good.
Yep.
Hi, Jeremy.
Hey, Megan. Great. All right. Very good. Well, we'll just wait a few minutes here and we'll have a number of media join us. And Brett, we'll do a sound check with you real quick.
Yep. Can you hear me?
Yep. Well, good. All right. We'll get started right at 1 o'clock. Hello, everyone. Welcome. Well, thanks for joining us. We'll get started here just in a couple minutes. Just hold on. We are, due to some internet issues in our part of Lincoln at the NHA offices, we may have to end up sending the recording out after the call to the media. Usually we're able to have the media record as we go, but we may have to end up sending the recording out after, but we'll get started here in just a few minutes. Welcome, everyone. We'll get started in just about another minute or two here. Okay, I have 1 o'clock. Again, I'm Jeremy Norquist, president of the Nebraska Hospital Association, and would like to welcome all of you to our call today. We are having some internet issues at in the part of Lincoln where the Hospital Association offices are. So we will have a recording for you, but unfortunately, we're not able to go in right now and provide recording privileges for everybody. So we'll get that to you as quickly as we can after the call wraps up. We really appreciate the interest from Nebraska media partners joining us today to talk about what's going on in our hospitals in Nebraska. We certainly are in a period of transition with healthcare here in the state. We are coming off of very high peaks of COVID. Just a month ago, we were at 767 hospitalizations in the state. We're now down to about 279. It's a decrease of over 64% in the last month. Positivity rates in the state have dropped from a month ago, about 20% down to 5.5%, so a drop of 72% in the positivity rate. And COVID patients are now taking up only about 9% of our ICU capacity for adult patients in Nebraska, and that's down from 29% recently. So we are on the right trend with COVID, but that certainly doesn't mean that our hospitals have it easy right now. We are still facing hospitals that are at capacity, trying to work to restore procedures that have been delayed that Nebraskans need. We're continuing to face ongoing workforce challenges among nurses and other healthcare professions. So that's what we're here to talk about today, is what's happening with our hospitals, as well as we'll be talking about how we can show appreciation for our healthcare workers this week. So we have 3 great hospital leaders with us. First, we'll hear from Kevin Miller, president of CHI Lakeside and Midlands Hospital. Then we'll hear from Brett Richmond, president and CEO of Methodist Fremont. And then finally, Megan Connolly, vice president of community pediatrics and child health at Children's in Omaha. So I'll turn it over to Kevin to tell us what's going on at CHI Lakeside and Midlands. Go ahead, Kevin.
Great. Thanks, Jeremy. Yeah, just as you reiterated, we have seen a significant pivot with our cases. It's hard to imagine, at least for CHI Health, just a month ago, we had 233 patients, and today we have 79. And so we are seeing that pivot. We have about 13 that are in our ICU and 10 that are on ventilators. And so for my campuses at Lakeside and Midlands, we have 7 of the 79 patients. But you can definitely see the change. Instead of having 40 or 45 patients in isolation, now we have 4. So that helps us tremendously. We can clear our hallways of carts of isolation and really start getting back to how we normally care for our patients going forward. What we have seen is we've been busy. As Jeremy alluded, staffing has been its challenge. You would thought with the decrease in COVID patients that our census would have dropped, but we are now starting to get caught back up on a lot of patients who delayed their care, especially surgical cases that we had delayed, especially during the peak of the COVID surge. And so we are challenged with our staffing across our system, but we are trying to figure out unique ways of mitigating that. We are partnering with several local schools to develop and retain certified nursing assistants. We're also working with the Latino Community Center and the Fulton Homes Education to look at CNAs or other professionals that would be willing to go on to nursing and to get that degree. And so we continue to work with that group. We do have a fair amount of travelers still in our organization. We have several still coming to really do two things. One, to shore up our staffing, but the other to give a little bit of a breather for our frontline workers, because they've gone through a lot. I can count like 4 or 5 surges that we've had where they had to work long hours, extra shifts, and they're just plain tired. And so we are seeing a turn, but we are trying to combat with the shortage of labor as we go forward.
Thanks, Kevin. Great. Now we'll go to Brett in Fremont.
Yeah, thanks, Jeremy, and thank you everybody for taking time out today to listen to our stories. I actually did this call. I went back and looked. I did it the last day of January. And like Kevin, we've had pretty significant changes in the last month. So from late October through January, we had been averaging here just in Fremont about 8 to 12 COVID patients a day. We're an organization that typically runs an acute care census in the low to mid 20s. So at sometimes, we were talking 40 to 50% of our typical patient volume was COVID patients. We also had our busiest, more positive patients come through our ED in January than at any month during the entire pandemic. But today that does look very different. We had half as many COVID positive patients in February as we did in January. And as of this morning, we just have a single COVID positive inpatient in our facility. And we've had about 1/3 as many people come through the ED and test positive this month as well. So we too are seeing a big change and getting a little bit of a reprieve. Kevin talked about the staff. We too are still busy. Again, a lot of that, as Kevin articulated, is kind of pent up demand, surgical and otherwise, that we haven't been able to do the last several months. And there's still a lot of other illness out in the community that we probably didn't see last year during the pandemic. We too are concerned about the short and long-term impacts of what our staff have been through the last several months and really almost the last 2 years, physically, mentally, psychologically, emotionally, and again, trying to kind of help them in a variety of different ways. We're hopeful that we'll have a little bit easier spring and hopefully through the summer to get them a reprieve. The other thing I would maybe highlight though too is the continued need for people to be vaccinated and boosted. One of the concerns I have is, if we don't continue to make progress on that front, I think we'll have a decreased immunity, should we see another wave, sometime later this year. And I think that's a concern that many of us in the industry have as well. We also do have an inpatient behavioral health unit. And as I was looking through our year-end 2021 numbers, we saw more than a 40% increase in our inpatient behavioral health admissions from 2021 as compared to prior to the pandemic. And, I think there's lots of reasons for that, but I think the primary reason for that really is the pandemic and all the stress that the pandemic has placed upon people in our communities. And so that's a concern that I think many of us have kind of going forward as well.
Thank you, Brett. Before I turn it over to Megan, I will just note for the media, if you have questions, please go ahead and put those in the chat. We will do those the same way that we have been doing those. So turn it over to Megan now to tell us what's happening at Children's, and then also talk to us about Healthcare Worker Appreciation Week that we're in this week. Go ahead.
Thank you, Jeremy. I echo what we've heard from these two gentlemen, Brett and Kevin, pediatrics experienced a whole different ball game than you guys did, but we are experiencing quite a bit of the same problems that you are seeing with your workforce. And that is what really led me to my project, which we'll describe. As far as COVID goes with children's, we too saw a large uptake or increase in cases in January. We were averaging around 5 inpatients a day because pediatrics were hit just so much differently. And in January, we were up to 18 patients. We are now back down to an average of 5, which is great. Today we had 7, 3 of those needing ICU care. But we agree with what Brett said. Vaccinations really are going to be our way out of this. And for the pediatric population, that is just as true. And our workforce is a challenge. We are implementing some of the same things that Kevin was talking about with CNA exposure and doing different techniques with LPNs and really advancing everyone to their top of their scope. But when we look at our workforce, that led me, and Jeremy, thank you for inviting me to talk, and thank you to the Nebraska Hospital Association for your support of this. But I have the pleasure of being involved in Leadership Omaha this year with the Omaha Chamber of Commerce. And we are all assigned a small group project. And my small group, we were trying to decide on a project when I happened to get a call from one of my team members. And the call was just to notify me that they had to call the police because we had a family member who was being belligerent and threatening one of our staff because our staff asked them to put their mask on. And I came back to the table and I think I must have looked a little exasperated because my group, who no one else is in healthcare, asked me what that call was about. And I told them, I said, 2 years ago, healthcare they were heroes. They listened to what we said. And fast forward now, and our staff are not only burnt out like both Brett and Kevin described, but they are now not being treated very nice all the time. So we took that and we made that our project. So our project is Healthcare Appreciation Week, which is the week that we are in right now from February 28th to March 4th. And we started just a small idea and it really has grown. And Mayor Stothert has signed it over to the city as a proclamation that this week would be Healthcare Appreciation Week. The city council will sign this tomorrow. Commissioner Borgeson took it to the Douglas County Board of Commissioners and they did a resolution. And with Jeremy's help, this goes to the legislative floor, I believe today with Senator McDonald. So this really has grown. We have received multiple messages from businesses around that they are going to participate. And we just asked for something simple, nothing that really costs the companies anything, but it's basically just a thank you. And to wear white, to put on social media, a thank you to all healthcare. And that's not just the nurses and doctors, but that's everyone that works in our organizations. Everybody is taking the same hit. So we are extremely happy that this really has caught on. And many of the people that I see on this call have participated, and I do thank them very much also.
Great. Thank you, Megan. Thank you for leading that. And the Hospital Association's honored to be part of that and try to make it a statewide effort. At our Advocacy Day on Wednesday, we'll have ribbons to distribute for Healthcare Worker Appreciation Week. And like you said, it'll be before the legislature. Just a couple other items before we hop into questions here. Just wanted to highlight, we continue to work with the state and are very thankful for Governor Ricketts and DHHS's work on the hospital decompression program. I know I've mentioned that on the call a couple times. The facility in Lincoln has been filled and patients are starting to rotate through there. Again, these are step-down skilled nursing level facilities that have been opened up for hospitals to be able to discharge those patients. The Omaha facility opened last week, and we're starting to get some Omaha patients discharged there. I think that'll be up to a capacity of about 30 patients at a time. And then the contract was just signed at the end of last week for a facility in Grand Island for an additional 30 beds or so. So we're starting to see that certainly will also help our hospitals try to transition through this period and get to some level of new normalcy, even though we know we have a ways to go yet with procedures that have been backlogged and work through those. The other thing I'll just mention, and certainly Healthcare Appreciation Week aligns very well with what's going on in the legislature. A lot of budget decisions are being made in this week and next, and we continue to advocate for a couple key pieces. One, bonus premium pay support for our frontline workers. During COVID, we've asked the legislature to use $50 million of rescue plan dollars from the federal government to make that investment to show support for our frontline workers. We're advocating for additional money to help rebuild the healthcare worker pipeline for community college and private nursing college support. And we continue to ask the legislature also to look at provider rates, as we know wage pressures will add to the personnel costs for hospitals, and we want to be able to pay our healthcare heroes appropriately, and certainly we need Medicare and Medicaid, the state and federal government to participate in that. So I just wanted to highlight those pieces. Again, thanks to our panelists, and now we'll take any questions. Media, if you have any other ones, please go ahead and put those in the chat box. The first one I have, are the COVID patients you still have mostly folks who have been in for a while, or are they newer arrivals? Kevin, you want to go first on that one?
Yeah, I would say that it's a carryover from patients that had already been in the hospital, hospitalized, and we're trying to find placement for them. I think all of us have figured out the patients aren't as sick as they're coming in with the Omicron. And so they can be treated effectively in the hospital or in the clinics and not have to be admitted. So I would say probably 25% of their new patients that are onset, but they have other comorbidities that are causing them to be hospitalized.
Right.
Yeah, we had almost the exact same experience here in Fairmont as Kevin.
Great. Yeah. Megan, do you have anything to add on that one?
You know, with kids, I think we're seeing more of a turnover. The sickest ones are staying in, but we're also seeing the comorbidities and then the co-infections with other respiratory viruses is adding to the complexity.
Great. Okay. The next question is, how relieved are you with the drop in COVID hospitalizations?
I would say, like Brett and Megan, there was a big exhale when we saw the volume going down, because you're always waiting for that next shoe to drop, and we didn't. So we're headed in the right direction, but as Brett said, we still need to work on the vaccinations and when it's appropriate, some of the masking where we need to. So definitely from our organization, and probably every healthcare person across the state, was a big exhale.
Yeah, I would echo that, but I would also remind everybody that we're all still really, really busy. It's a little bit more of a normal busy, but we're still all really busy, and our folks continue to work hard every day again to care for all the other sickness that's out there, and certainly to try to work through this kind of backlog of surgical and other cases.
Yeah, that kind of gets to the next question here. Should Nebraskans be worried about hospital capacity at this point, or have your facilities been able to return to normal operations as cases have fallen? I'm going to take that.
I can speak on behalf of Children's. We are back to normal operations, but as Kevin and Brett have said, we are still extremely busy with other things, and our workforce is still challenged. We are still really needing help from nursing staff and everyone who provides care. So that together has not let us completely out of the woods yet.
Yeah, I would agree. I'm not so concerned about capacity, but it's about the continued getting caught back up, making sure that we can deliver the care, quality care like we have been going forward. And continue to make sure that we stay in front of this with people getting their routine exams and not delaying.
Yeah, I think we all to some degree get paid to worry. So I'm not terribly worried about capacity, still very worried about our staff. And then, I think we all realize there's a very real possibility that we may have another wave at some point in the future. And so we continue to kind of plan and worry about that.
And to Brett's point and Kevin's point earlier, and I think Megan as well, about being vaccinated and boosted, we're only at about 32% of our total population in the state. Was the number we just got from DHHS on boosted percentage, 32%. So we know evidence has shown that the effectiveness of the vaccine wanes over time, and it's important that Nebraskans take that step to get boosted. So we can, avoid hospitalizations in the future when future waves or variants come our way. The last question I have in the box, and again, if anyone has any final ones, go ahead and post them now. But for Megan, how can Nebraskans celebrate Healthcare Worker Appreciation Week? Any additional details on that?
That's a great question. We're asking any of the buildings who can display white lights at night. That would be a great show of support, and just posting. Again, social media is really the way of communication. So posting on social media why you are thankful for the healthcare workers, and we're using the hashtag light white for the number 4 healthcare. I will put that in the chat so everyone can see it. But white ribbons are another that some businesses are doing, and I know Jeremy's going to use that. Just any way to say thank you to the healthcare workers, because they need to hear that versus some of the other things they're hearing right now.
Great, thank you.
Yeah, and I would just add, we all know people, we all have friends that work in healthcare, and I think simply reaching out to them, saying thank you, tell them you're thinking about them. I think that goes a long way with people as well.
Yeah, I agree. And just remember, I think sometimes we think of nurses and doctors. We have an entire team of healthcare workers. So I think sometimes people merely go to that group, and they are vital to what we do. But we have a lot of great, ancillary groups like respiratory therapy, occupational therapy, housekeeping, food service. It takes an army to really take care of the patients and community. So I would just echo that and reach out to anybody that is serving our patients in our community.
Great. Well, no more questions. Thank you all for participating, for our panelists. Thanks to the media for attending. Again, if you have any follow-ups or want to be connected to any hospital leaders, please reach out to the Hospital Association. We're here to help get that story out. And as I said earlier, we will be sending out the recording of the call shortly after here as we can. So thanks, everyone.
Thank you.
Thank you.
Thank you.